Well, actually, it's been predicted since before the national holiday, Eid al-Fitr, Lebaran holidays, actually. So we have a long annual holiday, and it's been a cultures of Indonesia, where the most populous Muslim countries in the world. So we always celebrate this. But unfortunately, this time the governments, they don't warn people to not go back to home. They don't want people to not have a family gathering for it. So as a result, now we could see the surging number, the significantly increased numbers of new COVID-19 cases.
Yeah. The WHO has urged authorities to introduce more stringent lockdowns. What do you think needs to be done to contain this latest outbreak?
We actually have to support and have to push the government to implement or to do a very, very strict restrictions, or just name it lockdown, because the government of Indonesia seems to be very resistant to do a lockdown as a nationally. So, but as we know that the cases now is a very high, and then we know that the vaccination coverage is very low. I guess it's still under 30% nationally. And then there are many health workers actually have received a full dose of vaccinations. But we could see that over the past week, actually the number of the healthcare workers who died or who are infected of the virus is actually getting increased too. So actually this is the time for the government of Indonesia just say, okay, let's do the lockdown for maybe a month or a month and a half, I think, just in order to control the spread and the growth of the virus.
I guess what they are continually doing in a country that, of course, has a lot of poverty is juggling the economic impact of a lockdown.
Of course, but over the past 1.5 years, we actually have the government have taken the decisions that they would try to balance between economic and also public health. And as a result, we now, I think we could see the increased number, the hospitals and health system almost collapsing, and then so many people still losing their job. So many people couldn't afford to pay their own bills. So this is the result of balancing between economy and public health. But I would say this is not a perfect balancing, but instead, I guess the public health interests are way behind the economic interests.
Yeah. And let's talk a little bit about the health system. You talk about it being under a lot of strain. How full are the hospitals? What even are the programs for vaccinations? I mean, you've got about 10% of people vaccinated.
Yeah. Yes. Currently, we know that many people cannot. They don't have access to health facilities. So many hospitals are fully occupied now. We're in Lapor COVID-19 actually trying to help people to get a bed in hospital or either the ICU in the hospital. But actually it's getting very difficult right now to find a hospital. And then one patient that we help to try to move from a regular bed, a regular room at the hospital to ICU, for example, we couldn't find it. And as a result, in less than 6 hours, the patient died.
That's extraordinary. Really trying times, Irma. We will watch with interest. Thank you so much.
You're welcome.